And so I would like to say thank you to Sister Nate for your kind invitation that I can come and be part of this conference today. I was asked to talk about the path to hunger eradication, and I'll stick to the topic as you gave it to me. I'll talk about two things spanning over many slides, but the first one is I want us to understand the problem, and nothing new is going to come out of this because these are things that we do, but I want to put them in context and also on the understanding that we come from various backgrounds, and some of us may not have that intricate understanding of the context and the things that are happening in our country. First and foremost, let's talk about zero hunger. As I was looking for a graphic to put on this slide, I landed on this one and I loved it because it speaks a lot about what the zero hunger goal that we are all pursuing as a nation and also as a people on this planet are gearing towards. The United Nations on their website says that this goal of zero hunger aims at eliminating extreme hunger and malnutrition. The understanding of malnutrition should be that it encompasses undernutrition, it encompasses micronutrient deficiencies, and it encompasses a growing problem in our country of overweight and obesity. But why focus on zero hunger? Our collective actions as a people living on this planet is we have an understanding today that extreme hunger and malnutrition are barriers to sustainable development. Secondly, that extreme hunger and malnutrition create a trap from which people cannot easily escape. And Malawi is an example of a country that has been entrapped and it's becoming increasingly difficult for us to escape. Number three is that extreme hunger and malnutrition, when it prevails, is allowed to prevail, it makes individuals to become less productive. So it means that public workers, people working in the private sector, people working on their farms, our productivity collectively is lower than it should have been if we were not a hungry nation. As well, people who are hungry, who have a particular extreme hunger and malnutrition results into low resistance to infections, and we become prone to various forms of diseases. And lastly is that individuals that are in extreme hunger and poverty are unable to earn more and improve their livelihoods. Our collective vision as a nation is to have an inclusively worthy and self-reliant nation. Enabler number 5 to this is human capital development. And as a nation, we have stated together that we shall have a globally competitive and highly motivated human resource. That's what we aim to achieve. That a Malawian from traditional authority Likoswe in Chiradzu district can stand on the global scale with another individual from Japan and be able to share ideas. A Malawian from Zorozoro can be in the Premier League and play football. Globally competitive and highly motivated human resource. I'm not sure how much we pay attention to the whole issue of human capital development, which is in Malawi 2063, our collective vision. But I thought I should, in slide number 5, give you a comprehensive definition of what human capital is. And I went to the World Bank and asked them what it is, and they told me via their website that when you talk about human capital, it consists of knowledge, it consists of skills and health that people invest and accumulate throughout their lives. And it's accumulated throughout their lives to enable them to realize their potential as productive members of society. Number two, that when we invest in people through several layers of actions, in nutrition, in healthcare, quality education, jobs and skills, we help to develop human capital. And this is key to ending extreme poverty. The actions on how to end poverty are well known, but there are certain things that make us not achieve that. Now, because we aim to have a globally competitive human resource, and that human capital development is one of the enablers to achieving the Malawi that we want, let us see the status of Malawi today. And I want you to take a look at slide number 6. Slide number 6 maps the entire world by looking at the Human Capital Index, and this is 2020. The bar at the bottom is showing you as the green intensifies, it means countries are getting better. And as it lightens up, getting to the left, it means things are getting worse. And if you just take a look at that map of the world, North America, Canada, and the United States, deep green. Western Europe, deep green. Australia down there and Japan over that side, deep green. Please locate your country. And you find that our human capital index is at 0.41. Now it ranges from 0 to 1. So we're not even halfway through. We are not investing sufficiently in our citizens. And as we aim to 2063, we must embed these issues and understand them clearly, because otherwise we may not achieve that. Map of the world number 1 shows you Malawi is at 0.41. How poor are Malawians, you may ask? Well, according to the World Bank, 2023, 70% of Malawians live on less than $2.15 a day. And according to the National Statistical Office, multidimensional poverty affects 59% of Malawians. Malawians who have several things lacking in their homes, including access to clean water, nutrition, and other factors at household level. Whatever indicator you want to use, it's very clear that this is a poor country, or indeed Malawians are poor. The greatest burden in terms of multidimensional poverty is in Machinga and Mangochi. At 78%, there's no other districts above 78%. Meaning that only 22% in those 2 districts are not multidimensionally poor. Please focus on Machinga. Machinga is one of the interesting districts in this country. It tops in terms of daily deliveries of children in their hospitals. Every month, in Machinga district hospital and the health centers, it's over 1,100 children are delivered in that district. Already I'm trying to position you to say, begin to think about how many people live in this country. Zambia is 6 times larger than Malawi, but Malawi and Zambia have a similar population. We are packed in this country. We must be doing something about our birth rate. Otherwise, the resources we have are going to be depleted soon. How poor are Malawians? I want to take you through poverty in terms of hunger. And therefore, the question I'm going to answer now is, so we've shown in terms of poverty, multidimensional poverty, and lacking $2.15 a day. But now let's zero in into nutrition. So the question I'm asking is, how hungry poor are Malawians? The first one I want to show you is an indicator called minimum acceptable diet. This is an indicator that is created when you assess children aged 6 to 23 months based on the diversity of their diets and also based on the frequency that they are fed. According to the National Statistical Office, the last survey, multiple indicator cluster survey of 2019-2020, only 9 in 100 Malawian children are being fed complementary feeding that meets the minimum acceptability. Reverse that, 91 out of 100 Malawian children, yes, they are eating, but their diet does not meet the minimum standard of quality. And that's a problem with nutrition. People are busy eating, but the quality of what they are eating matters. And we should be paying attention to the quality, because when you talk about hunger, it's not just going to bed without eating anything. We can fill our bellies with food, but is there quality in it? How poor are Malawians? Number 2. In 2015-2016, Malawi first generated nationally representative data on prevalence of a nutrient called zinc. It's found in foods of animal origin and plant origin, but the one in plant origin has a problem because when you consume it, it's usually locked up and not available to the body because of some elements found in legumes and cereals, unless we do some processing to reduce what is called phytic acid. But also, Malawians, in terms of our intake of the best dietary sources of zinc, which are animal source foods, that's one of our biggest problems. And so when we go next time to do pass-on programs in the communities where we work, the work we support, we need to give it realistic thought to say, are we really implementing programs, initiatives in terms of increasing livestock in the communities that really is going to have an impact? The survey conducted then showed that 60% plus of Malawians have deficiency of zinc, ranging between 60% in under 5 children to 69% in girls aged 10 to 14. Deficiency of zinc has many consequences. We can talk about that at a later time. How hungry poor are Malawians? Let's take a look at another mineral which is called selenium, S-E-L-E-N-I-U-M. You don't hear about selenium. It's a micronutrient. We need it in very tiny amounts. A study done by Felix Pensulo as part of his PhD studies at the University of Nottingham, he published one paper back in 2019 showing that 63% of Malawian women of reproductive age are deficient of selenium. When you look at the map of Malawi to your right, what you generally see is a red shade in that map other than the blue. The blue means that there is unlikely going to be a problem in those areas, but the red means there is a problem, and the deeper the red color, the bigger the problem. Where do you see some red, blue shades? Lower Shire, along the Shire River. And you see it around Mangochi and somewhere in Kota Salima. Other than that, you see red and red and red and red, including Lilongwe, Kasungu, and all over the place. Nearly 2/3 of our women lack selenium. I'm trying to prove the fact that Malawians are hungry poor. How hungry poor are Malawians? Let's take a look at a problem that you have probably heard quite a lot, which is the problem of stunting. According to the World Health Organization, prevalence of stunting of 30% and above is considered very high. That's the label according to WHO. Beyond very high, there's nothing else. We've started tracking consistently the prevalence of stunting in our country back in 1992 with a demographic and health survey. And the numbers are speaking a language very clear to you and I. Even by 2020, 36% of Malawian children under the age of 5 are stunted. My colleagues and I just concluded in March this year a study in 13 districts, round 8 nutrition smart survey. We reached out to thousands of households and generating data from 6,300 plus children, aged 0 to 59. What we found in those 13 districts only is that prevalence of stunting is actually appears to be going up because it was at 39%. Our country lacks resilience in our food systems. Because beginning with COVID, what else did we have? Cholera. What else? We had Tropical Storm Anna, Tropical Storm Gombe, Cyclone Freddy, 44% devaluation, and other devaluations. And who knows what else is going to come this year? I'm not a prophet of doom, but we appear to be addressing a problem after another every year. Experts are already telling us that we had El Nino last year. We will have La Nina this year, and it may pour rains in this country. The gains we have made in nutrition, we are losing them as a nation because we move 2 steps forward and 3 steps back. No wonder when you look at this world map says that 90% of stunted children lived only in 36 countries, including Malawi, back in around 2008. 90% of the burden only in 36 countries. Please locate Lilongwe. We are on the world map again for the wrong reasons as a nation. Here's another map, UNICEF comparing 2012 and 2022. What UNICEF has said, and UNICEF, World Bank, and the World Health Organization, is that the burden of stunting was that there were 46 countries that had very high prevalence of stunting back in 2012. And please notice, Malawi was one of those countries in 2012. UNICEF, WHO, and World Bank produced this map again for 2022. And the number of countries that have very high prevalence of stunting has gone down from 46 to 28. But we remain in the league, even when others are changing. We should begin to question our actions, our interventions, because it means they're not working. There's something that's not working in our country. When others are moving out of the hunger poverty, we remain there. One of the problems that we have, by the way, is that we live on cereals as a nation. This data, produced by colleagues working in International Food Policy Research Institute. The orange or yellow, if it appears that way to you, is cereals. What is Malawi's greatest source of energy? Cereals, contributing 74% of our energy comes from cereals. And when I talk about cereals, there's one cereal that dominates them all. I ask this question to my students and many nutritionists, what is the main source of protein in the Malawian diet? And the answers I get is beans and fish and other things. No. In my exam, you get it wrong. The greatest source of protein in the Malawian diet are cereals. Cereals contribute 67%. 2/3 of our protein comes from cereals. What else? Iron. 79% of our iron is from cereals. Zinc. 78% of our zinc is from cereals. The challenge is that because our diets are not diversified, our people in this country are not able to access many components of the diet. They rely on cereal to fill the belly, but they are hungry inside. No wonder micronutrient deficiencies are as high as I have shown you this morning. In May, Save the Children released this report. A fascinating report, but very disturbing. They're looking at the cost and affordability of nutritious diets in Malawi. And they have used some methodologies that they have developed and others borrowed elsewhere. Their aim was to estimate trends in the minimum cost of a nutritious diet and identify affordability gaps. They used the cost of diet assessment research methodology. And this was a longitudinal study looking at what's going on in our country from April 2021 through to February 2024. And they were looking at monthly prices of 29 essential food items in 77 markets across Malawi in 25 districts. If you haven't seen the report, I have a few graphs that I would like to show you. I know you know that the cost of a healthy diet is high, but I'm not sure you're aware of how high it is. And I'm going to show that to you. Do you know that between April 2021 to February 2024, the price of maize has gone up 503% in the 77 markets that they have been monitoring? And the monthly changes are as you see them. Remember, maize contributes most of our energy, protein, zinc, iron, and other nutrients. What it means now is that even the availability of calories in the home is becoming a challenge for Malawians. Here's another graph. This is comparative analysis of selected food items. You might say, well, that's just maize, but take a look at other food items. The prices have been going up. The next graph is monthly cost fluctuations for a food habits nutritious diet. They generated that indicator. 210% increase in terms of the food habits nutritious diet. Looking at people normally eat in their communities, it's gone up. They looked at affordability. This is monthly income versus cost of food. The legend is up there. If you're very far away, seated in here, the blue or green, it's interpreting it green, monthly income, and then the orange red is monthly cost. So if you take a look at that, the incomes are the ones at the bottom, but in terms of cost is what you see in the amber, in the yellow. In the remarks that Kate mentioned about the disparities in terms of income. And when Save the Children plotted the household availability gaps, looking at the ultra poor, so you got a legend at the bottom, ultra poor, the poor, rural households, average Malawian, and urban. Urban is the blue line, and the ultra poor is the dotted red line. Percent affordability, how high has it gone for the ultra poor from 82% in 2021 to 271% in 2024? Look at you and I living in the urban area. Our line is the blue one. The poor of the poor are feeling the pinch. They're getting worse and worse. And that's why I coined in this verse. It doesn't exist anywhere in the Bible, but I'm saying, woe to the ultra poor, for they shall suffer the most. Proverbs 300, verse 300. Colleagues, woe to the poor, ultra poor particularly. Look at them. Look, everything is not working to their advantage. And so when we sit in a magnificent place of this nature and make decisions, those of you from Capitol Hill, just a kilometer away from here, be looking at these data and make real decisions that are going to lift people up. UNICEF some years back introduced an indicator with World Health Organization, what they call child food poverty. It's a very interesting indicator that looks at dietary diversity. And they've been producing reports every year. The latest report of 2024 shows that child food poverty has increased in Malawi from 52% in 2010 to 57% in 2020. It's measured by looking at children who have access to less than 5 out of 8 food groups defined by WHO and UNICEF. The number of children, the proportion of children being poor in dietary means is increasing in our country. Perhaps your question is, what can we do about it? This is the last part, too. There are several thoughts that I thought I should share with you. Number one is to say that we need evidence-based policies. And I want to show you the case of iodine deficiency. These are brain scans, I think came in the 1960s. Up there you see iodine sufficient. They are using, by the way, animal models to scan their brains. So animals that were made iodine deficient and others that were made iodine sufficient. What you see at the bottom is how the brain of an animal would look like when there is iodine deficiency. And what you see above are brains, the network in the brain when there's sufficient amounts of iodine. Malawi used to be called, when I was doing my undergraduate, we would say, the way you would write, Malawi is a landlocked country, etc., we would write, Malawi is an iodine deficient country. That was an opening statement then. Today, if you write that, you're wrong, because we are no longer an iodine deficient country. Why? Because we used evidence to fix the problem. Simple. That's the solution. Sometimes we go around and implement things that look nice to us, but that do not have real evidence on the ground. We should be concerned about those things. Number two, in terms of putting weight on the evidence-based policy, there's the issue of what are called territorial markets. And the keynote speaker talked about markets. Markets, I live at Bunda, and it's just a few kilometers from a big market called Mitundu. And you see the importance of market when you live close to it. How much it saves people around. This is an interesting article from the UN Nutrition Journal. The UN has a nutrition journal. And the title of this one was Unveiling the Potential of mapping territorial markets to contribute to healthy diets and nutrition, written by the names you see over there. Their aim was to unveil potential territorial markets to ensure access to healthy diets and better nutrition. And they looked at retail and consumer data from 19 territorial markets in 3 countries, Burkina Faso, Malawi, and Rwanda. In the process, they identified markets where supply of specific food groups should be strengthened, and those more relevant to ensuring that consumers have access to a healthy and diversified diets. What is the evidence? When you look at the markets, the territorial markets, in Malawi, when you put all of them together, there are certain commodities that are more likely to be found in markets and others that are not likely to be found in a market. And therefore, if a market elsewhere has, for example, dairy products, it means that people in that locality who use that market are likely to consume dairy products. So by paying attention to markets, this is the pathway through a platform that everyone uses to go and get what they want. You and I know where we want to get brown bread, whole wheat bread, white bread, cooking oil of this nature or that. Our markets, because we live in Lilongwe, Blantyre, and Zeus and other places, we know where to head to. The market is important for providing nutritious diets to people. So the question is there anything that we can do about markets to improve availability of certain food commodities in those markets? Because if the food commodities are not there, people will not find them, people will not ask for them, and it means people, if those commodities, food items deliver certain nutrients, it means people in that area who rely on those markets are less likely to have access to the nutrients of concern. Markets. So number one is evidence-based policy. Number two is behavior change. Friends, we need to change behavior. Gilbert and colleagues from the International Food Policy Research Institute compared data for Malawi for 2010-2011 and also 2016-17 using what is called the Integrated Household Survey. And when they compared the dietary sources of protein, I gave you an idea about this earlier. Take a look at what the cereals are doing. These are grams of protein that we consume every day. The cereals are way above everyone else. Number two, where does our protein come from? The legumes, the pulses, and the nuts. But see, it's around 7 grams when cereals have delivered nearly 40 grams. Look for the meat, offals, and poultry, just around 3. If you're thinking of eggs, they are contributing less than 1 gram of protein a day. This is a reality. Now, how do we help people to eat healthy? The government of Malawi in 2021 launched this document. It's called Eat Well to Live Well. If you don't have this document, I got it for free. I'll share it with Sister Nate, Elizabeth, and she'll be able, as she invited all of you. It's written in a very simple way so that everyone can use it. It's not an academic document. It presents the science as we know it today. Eat well to live well. Where the Malawi Congress Party is meeting right now, and the president has been there throughout the night, he was there on the 2nd of September 2021, and he launched Eat Well to Live Well. One of the statements the president made on that day, he was concerned about too much intake of nsima. And when the president said that, the papers carried it. One said, nsima obsession worries Chakwera. Another wrote, Chakwera calls on Malawians to eat less nsima. Which in my opinion is a correct summary of what the president was not saying don't eat nsima. He didn't say thou shalt not. He said eat less. By eating less, where the nsima has been taken away, throw in other components of the diet. That's my understanding. And that's what the president clearly said. I was there in the auditorium. Now, whenever people don't like someone who says, change your mind, change the way you do things, we always react. And I want to share with you how Malawians reacted when the president said, eat less nsima. A student of mine sent me some discussion. This was on Facebook, and so it doesn't matter showing them. This is Mighty Lamulani. He said, Mr. President, you need to know how to talk to people. This is an insult because Malawians have been eating nsima from generation to generation. Even you yourself, Mr. President, to be at Kamuzu Palace, it's because of nsima. We begin putting barriers when people tell us, change your mind, change the way you do things, because we're used to it. Clement Chikondi Piri said, you can do whatever you want to do in this government, but please, I repeat, please leave the issue of nsima alone. The point I'm making is that as a nation, collectively, we are not willing to change behavior around the food we eat. And if we are not ready to change behavior around the food we eat, one wonders what else we are not ready to change, even when experts tell us to eat healthy. Let me show you two more reactions. This is Mustafa Aubi says, Mr. President, you don't have brains to, you don't have a brain. Think twice before speaking. And finally, Happy Selevende says, we can talk other issues, but don't tamper with nsima. It's an anointed one. The moment we begin seeing things in that perspective, there is some, I mean, these are only a few Malawians reacting, but it represents a voice. How many people think about this issue? But what does the government of Malawi say is healthy eating? And I want you to check what you eat at home regularly, not when you come here, perhaps maybe when you come here, but what you eat regularly at home. I show this to my students and they say, no. How can you say that's a healthy eating? They say we need to reverse the statements. And this is, according to Eat Well, Live Well, this is a definition of healthy eating. A healthy diet consists of plenty of what? Vegetables, fruits, whole grains, legumes, nuts, healthy fats, and oils. Plenty. For those, no speed limit. Number 2, moderate amounts of fish and chicken. Number 3, this one students don't agree with. Low amounts of red meat. They'll say, are you sure meat? Low amounts? And then lastly, what should we eat in very low amounts? Processed meats. The sausages and stuff in very low amounts. Added sugar in very low amounts. Salt. I mean, some of us have a behavior. We begin eating. We just say the grace on the table, and amen is sounded and chorused on the table. The next thing is salt shaker. Refined staples and other highly processed foods. We are consuming highly processed foods. Our children now, everywhere, are consuming highly processed foods. They love to buy it. I'm going 2 slides to go. The third thing is sustainable nutrition financing. And I want to indicate here that we now have nutritionists in every district in our country. The first nutrition education and communication strategy spelled out the creation of nutrition focal points. That's what was called then back in 2012. Now they are called Principal Nutrition HIV and AIDS Officers. And everything that you see there, the structures, were created in the Nutrition Education Communication Strategy number 1 for Malawi. But when did we create a budget line for them. Sisanet and Sisona will tell you it's just recent. Yes, created, but now is there money for these officers to use? If you go to the Pinao at Chiradzuru District Council, do they have money? Number 2, finance implementation of national nutrition response. At the end of the day, government has the primary responsibility. The state must support a nutrition response. Remember, we are aspiring a certain status of a nation by 2063. Nutrition is one of the ways to get there. If we don't support, if the state doesn't put in as much resources in this, and we wait for partners, yes, the partners bring in resources, but the state has to be seen to walk the talk and take lead. Number 3, in terms of sustainable nutrition financing, this is a government thing. They need to fix national level coordination. The Department of Nutrition. That has been tossed from place to place to place to place. When it was created by Professor Bingwa Mtarika, back in 2004, they placed it in the office of the President and Cabinet. Countries from around Africa were coming to Malawi to learn the Malawi model of coordinating nutrition from the President's office. The President, therefore, by default, he was the de facto Minister of Nutrition. We took it out of there. It's under an implementing ministry, the Ministry of Health. As I speak, now it doesn't have a director. The director has proceeded to do other things. There have been structural changes, people resigning and other things. Let's talk about these things. They speak. And if officers in there have attitudes and other things that partners don't like, I fear for the future. We've got to say these things openly. Finally, let us fix food systems. And what are we talking about? According to the Food and Agriculture Organization, agri-food systems has to look at several components. Systems that support food production. Number 2, systems that support food supply chain. Number 3, systems that affect the food environment. What's around? Can people afford food? Consumer behavior is another thing we need to fix. I've already shown you how Malawians reacted when the President said eat less in Sima. And lastly, all that is going to lead to a healthy diet on the table if we do things right. But if we don't, the opposite is what is going to happen. Have I lost hope for Malawi? I haven't. I believe in this country. I believe in our collective ability that the Malawi we want is achievable, but it will not just come unless we decide to make certain changes. I thank you very much for your kind attention. Thank you.
Thank you very much.